I'm here reporting today from Y'all Broadcasting, and I have the pleasure of interviewing Kathy Coughlin. So Kathy, tell me, for the past 10 years you were working as Director of Quality and Patient Safety. Can you tell me a little bit about that position?
Sure. Actually, I worked in quality for 20 years. In the first 10 of those years, it was very, very different than what it eventually evolved into.
Tell me what was different, what changed?
Well, in the beginning, what we did was audit within the hospital, within each department. There was no sharing of information. The hospital itself, the department itself, decided what the standards are and what the goals were. So there was no comparison with anyone else or any other facility, which meant that you really had to rely on the hospital to develop good standards and goals. And the purchasers of the health care, which would be the insurance companies and in particular the government, paid for a large part of their health care. And their expectation was that there would be efficient and effective care. And so they decided how to measure that, what to measure, and what to be reported. So it was very, very different. It was now each hospital can compare themselves with other hospitals.
So we're talking about patient outcome standards, cost of services, as well as operational standards.
Correct.
And did the state hold any standards for you?
Absolutely. The state is involved because the state also participates in paying for that health care. New York State was very interesting because what it did is one of the first states to do this was to require reporting of adverse events to them and to demand a root cause analysis of those events with actions and goals to meet with those actions. And if those goals weren't met or if they weren't satisfied with the actions that were determined, they could levy fines on the hospitals. So that became a financial thing also. In addition to the State Department of Health, the Joint Commission was an organization that was actually begun by surgeons so that surgeons would have a similar standard of care across all practices. That was in the early 1900s. It eventually became a survey process to accredit hospitals to assure that they are following standards that the Joint Commission was able to put together.